trabaho, balik buhay.
Magbalik buhay, magpabakuna.
Magandang hapon na Pilipinas, no? Napakadami po nating balita ngayong araw neto. Simulan po natin sa usaping bagyo. Nakikisimpatya po kami at nakikiramay po sa mga nasawi dahil po sa bagyong Maring. Ayon sa ulat ng National Disaster Risk Reduction and Management Council, as of October 14, 2021, 30 na po ang namatay, 3 injured at 14 ang nawawala. Nasa 1,775 displaced families or 7,370 displaced persons ang nasa 124 evacuation centers sa Regions 1, 2, 3, Mimaropa, 6, Caraga at Car. Nasa mahigit 2 milyong piso ang assistance na naibigay sa Region 2, Region 3, Mimaropa at Car. Kasama rito ang family food packs na nasa 1.7 million pesos. Samantala, as of October 13, 2021, ayon sa DA, ang estimated cost of damage sa agrikultura sa Regions 1, 2, Car at other regions ay nasa 692 million pesos. Ayon sa DA, as of October 13, 2021, ito pong ilan sa mga intervensyon ng pamahalaan para tulungan ang ating mga magsasaka at mangingisda. Quick Response Fund, amounting to 172 million para sa rehabilitation ng mga apektadong lugar. Ready na for distribution ang 169,998 bags ng rice seeds, 16,601 bags ng corn seeds, at 1,480 kilos ng assorted vegetables sa mga apektadong rehiyon. Drugs at biologics para sa livestock at poultry, indemnification para sa affected farmers at fishermen mula sa Philippine Crop Insurance Corporation, Sure Calamity Assistance Program na may budget na 650 million para sa 32,500 affected farmers, fishermen sa Regions 1, 2, and Car. Nasa 20,000 po ito bawat recipient household. Zero interest at no collateral, 10 years to pay. Sa balitang IATF, inaprubahan po ng inyong IATF ang revised rules for green list for international arriving passengers effective October 14, 2021. Dami po nagtatanong, ang Estados Unidos po ay yellow list. Okay? Para sa fully vaccinated foreign nationals, kinakailangan nila ng negative RT-PCR test na isinagawa sa loob ng 72 hours bago sila umalis sa country of origin. Pagdating sa Pilipinas, hindi na nila kinakailangan mag-facility quarantine, pero kinakailangan nilang mag-self-monitor ng sintomas hanggang sa 14th day. Para naman sa mga Pilipinong fully vaccinated, pwede silang mag-facility-based quarantine hanggang lumabas ang kanilang negative RT-PCR test na kinuha sa quarantine facility upon approval. Or, kung ayaw nila mag-facility-based quarantine, kinakailangan mag-present ng negative RT-PCR test within 72 hours bago sila umalis sa country of origin. Pero kinakailangan nilang mag-self-monitor ng simptomas hanggang 14th day. Sa mga unvaccinated or partially vaccinated o mga taong kung saan hindi ma-verify ang kanilang vaccination status, ang mga bakunadong hindi makapag-test before travel, kinakailangan nilang mag-facility-based quarantine hanggang sa lumabas ang kanilang negative RT-PCR test na ginawa sa ikalibang araw. Para sa mga foreign nationals, kinakailangan nilang mag-book ng hotel reservation na hanggang 6 na araw. Samantala, ang mga unvaccinated or partially vaccinated minor children na bumabiyahe kasama ang kanilang fully vaccinated parent or guardians are required na sundin ang quarantine protocols na naaayon sa kanilang mga vaccination status. Kinakailangan samahan ng parent o guardian ang bata o menor de edad sa quarantine facility sa kabuuan ng kanilang quarantine period. Para naman ma-validate ang vaccination status ng mga overseas Filipino workers at kanilang mga spouse, parents, and or children na nagtatravel sa Pilipinas o abroad at mga non-OFWs na nabakunahan na dito sa Pilipinas at sa ibang bansa at mga foreigners na nabakunahan sa Pilipinas, maaring ipakita ang kanilang VaxCert Digital Certificate, Bureau of Quarantine, World Health Organization issued International Certificate of Vaccination or Prophylaxis, ICV, or ang National Digital Certificate ng foreign government kung saan sila nabakunahan. Para sa mga foreigners na nabakunahan sa ibang bansa, maaari nilang ipakita ang kanilang W-issued ICV o ang National Digital Certificate ng foreign government na tumatanggap sa VaxCert-PH under a reciprocal agreement. Paghuli, inaprubahan din at inadapt ng IATF ang mga revision sa guidelines on the implementation of alert level system for COVID-19 response in the pilot areas. Inaprubahan din ng inyong IATF ang paglalagay sa Metro Manila sa ilalim ng Alert Level 3 simula October 16 hanggang October 31, 2021. Ito po yung sinasabi natin nung nakaraang press briefing na dahil nasa moderate po ang ating healthcare utilization rate at moderate din ang ating 2-week attack rate at daily attack rate, po pwede nga pong maibaba sa level 3 ang alert level sa Metro Manila at nangyari na nga po. Puntahan naman natin po ngayon ang guidelines for areas under Alert Level 3. No? Unang-una po, pinapayagan ng intrazonal or interzonal travel subject sa reasonable restriction base sa edad at comorbidities as may be determined by the accepting LGUs. Isa-isahin naman natin po ang bawal o hindi po pwede sa Alert Level 3. No? Ito po mga bawal. Face-to-face or in-person classes for basic education, contact sports except those na kinukonduct po sa bubble type setup. No? Number 3, yung funfair, ferias, and amusement industries, yung mga playgrounds, playroom, kiddie rides, bawal pa rin po. Yung mga venues with live voice or wind instrument performance and audiences, mga karaoke, bawal pa rin po clubs, concert halls, at theaters. Yung mga casinos, horse trading, cockfighting, and operation of cockpits, lottery, and other betting stations, and other gaming establishments except when authorized by the ITF or the Office of the President. At saka yung mga gathering in residences with individuals not belonging to the same household. Bawal pa rin po yung pagtitipon na sa mga bahay-bahay na hindi kasama sa mga kasama sa bahay. No? Ano naman po ang allowed? Well, ang allowed po ang general rule is 30% indoor venue pero para lang po yan sa fully vaccinated, no? At 50% outdoor venue para sa lahat, whether or not fully vaccinated or hindi vaccinated. Kasama na po dito sa rule na 30% ay ang MICE, yung meetings, incentives, conferences, and exhibitions, yung social events para sa mga venues, para sa mga parties, wedding receptions, engagement parties, etc. Yung mga visitor or tourist attractions, gaya po ng mga libraries, archives, museums, galleries, exhibits, park, plazas, public gardens, scenic viewpoints or overlooks, amusement parks or theme parks. Yung recreational venues, gaya po ng internet cafes, billiard halls, amusement arcades, bowling alleys, public gardens, scenic viewpoint, bowling alleys, skating rinks, archery halls, swimming pools at similar venue, cinemas and movie houses. Pero 30% po lang vaccinated. Tsaka yung mga examinations na pwede nang ma-administer. Mga entrance, qualifying examinations na mga iba't ibang government agencies at mga iba pang mga test at examinations na na-approve ng IATF. Kasama rin po sa pwede na 30% indoor venue para sa mga fully vaccinated at 50% para sa outdoor ay ang in-person religious gatherings. Kasama na po dyan yung para sa mga necrological service, wakes, interment, funerals, para po doon sa mga namatay other than COVID-19 at saka yung cremains of COVID-19 deceased. No? Yung mga dine-in services po ngayon, no? 30% yan for fully vaccinated, 50% for outdoor. Yung personal care establishment, barbero, hair spas, hair salons, nail salons, yung mga aesthetic, cosmetic services, procedures, mga makeup services, salon, spa, reflexology, and other similar procedure. Ang mga gyms and fitness studios, patuloy pong bukas sila. At saka ang mga film, music, TV production subject to the guidelines po na inisyu ng DTI, DOLE at ng DOH. Now, samantala, inaprubahan din po ng inyong IATF ang paglalagay ng mga sumusunod sa lugar sa ilalim ng MECQ. Basahin po natin. No? Ang MECQ po ay ang sa Luzon po, ang mga probinsya ng Apayao, Kalinga, Batanes, Bulacan, Bataan, Cavite, Rizal, Laguna at Naga City. Sa Mindanao, sa Zamboanga City po at Zamboanga del Norte. Ito naman po ang mga lugar na nasa ilalim ng GCQ with heightened restrictions. Sa Luzon, Abra, Baguio City, Ilocos Sur, Pangasinan, Cagayan, Isabela, City of Santiago, Nueva Vizcaya, Quirino, Quezon at Batangas. Sa Visayas po, ito po ang mga lugar, no? Bacolod City, Capiz, Lapu-Lapu City, Negros Oriental, Bohol. At sa Mindanao, Zamboanga del Sur, Misamis Oriental, Cagayan de Oro City, Davao del Norte, Davao Occidental, Davao de Oro, Butuan City at Surigao del Sur. Ang mga lugar na mapapasailalim po sa GCQ ay sa Ilocos Norte, Dagupan City, Ifugao, Benguet, Tarlac, Lucena City, Oriental Mindoro, Oriental Puerto Princesa, Marinduque, Albay, Camarines Norte. Sa Visayas po, ang mga probinsya na Aklan, Antique, Guimaras, Negros Occidental, kasama na po ang Iloilo City, ang Iloilo Province, ang Cebu City, ang Cebu Province, ang Mandawi City, Siquijor, Tacloban City. Sa Mindanao po, kasama po dyan ang Zamboanga Sibugay, Misamis Occidental, Iligan City, Davao Oriental, Davao del Sur, General Santos City, Sultan Kudarat, Sarangani, North Cotabato, South Cotabato, Agusan del Norte, Agusan del Sur, Surigao del Norte, Dinagat Island, Cotabato City at Lanao del Sur. Lahat po ng lugar na hindi nabanggit ay nasa ilalim po ng MGCQ. Sa balitang bakuna naman po naku po, halos 51 million na po or 50,966,144 doses na ang total vaccines administered ayon po sa October 13, 2021 National COVID-19 Dashboard. Nasa 30.8% na po ang fully vaccinated o katumbas ito ng mahigit na 23 million na katao. Dito naman po sa Metro Manila, 91.82% na ang nabakunahan or halos 9 na milyon or 8,976,489 ang nakatanggap ng first dose. 78.95 na po ang fully vaccinated or 7,718,283 na katao. Nagsimula na po ang bakunahan sa college students. Nagkaroon ng vaccine rollout kahapon, October 13, sa Mabalacat City College at Our Lady of Fatima University sa pangunguna ng Commission on Higher Education. Nasa 800 students ng Mabalacat City College ang nakatanggap ng first dose. Samantala, nasa 700 students naman po ang nakatanggap ng first dose sa Our Lady of Fatima University sa San Fernando, Pampanga. Ito pong ilan sa mga larawan. Sa COVID-19 update, nasa 7,181 ang nai-report na mga bagong kaso ayon po sa October 13, 2021 datos ng DOH. Lampas 2.2 milyon or 2,567,975 ang mga gumaling. Patuloy ang pagtaas ng ating recovery rate, nasa 95.4% na ito. Patuloy naman po ang pagbaba ng mga positivity rate natin na nasa 14.2%. Huwag nating kalimutan po ang mag-mask, hugas, iwas, at maging ligtas sa COVID-19 at huwag pumunta sa 3Cs, closed, crowded, close contacts. Siyempre po, dahil marami na ang bakuna, pabakuna na po tayo. Samantala, nasa 40,069 na po ang binuwi ng buhay dahil sa coronavirus, nakikiramay po kami. Nasa 1.49 po ang ating case fatality rate. Ito naman po ang kalagayan ng ating mga ospital. Sa buong Pilipinas, 67% na lang po ang utilized ICU beds, moderate risk. Sa Metro Manila, mas mababa pa po ito, 65%. Sa buong Pilipinas, 52% lang po ang okupado na isolation beds. Sa Metro Manila, mas mababa pa po, 44%. Pagdating naman po sa ward beds, 52% ang okupado sa buong Pilipinas, 48% lamang po sa Metro Manila. Ang mga ventilators, 49% po ang utilized at 50% po sa Metro Manila. Dito po nagtatapos ang ating briefing. Makakasama po natin ngayon si World Health Organization Representative to the Philippines, Dr. Rabindra Abeyasinge. Doc, thank you for joining us again. You are already our suke, but please tell us what was the recent WHO recommendation as far as third dose is concerned for those vaccinated with Sinovac or Sinopharm?
Thank you, Secretary Roque, and always a pleasure to join you here. This is a very important question because WHO has been looking very closely at the evidence evolving globally in light of the discussions for additional doses. And I want to take this opportunity to articulate that the Strategic Advisory Group of experts on vaccines has been reviewing the data, and we are now in a position to say that for people with immunocompromised conditions who have been unable to develop full immunity, WHO is supporting a third dose as an extended primary course. I want to differentiate this from the concept of boosters, which we generally talk for general populations. So this is specifically for those who are at risk because of their immunocompromised conditions, who are unable to develop and sustain the required level of protection from the primary course of 2 doses or 1 dose. For these individuals, WHO is now recommending an extended primary course, which includes a third dose. At the same time, we were also looking at the evolving evidence from individual vaccines. And, we had some concerns initially about the capacity and the immunogenicity of some vaccine brands. And based on particularly among the elderly groups. And so reviewing the data, the SAGE is now recommending that we consider the elderly population or the A2 population who have received a primary vaccination course with either Sinovac or Sinopharm as eligible who need to receive a third dose of the same vaccine brand to potentiate its immunogenicity. So our recommendation now is that in addition to immunocompromised individuals, that we include all individuals who have received a primary vaccination course of 2 doses with Sinovac or Sinopharm to receive a third dose, provided it's more than 3 months since the completion of their first 2 doses. So that's our position now. We will be waiting for a decision of the national authorities, but this is the WHO position. Thank you.
Clarify, Dr. Rabi, no? So the recommendation is all individuals who were vaccinated with Sinovac or Sinopharm be given third dose, or is it limited only to the medical frontliners, those with comorbidities, and the seniors?
Only the seniors at this point of time. Of course, those with comorbidities who we recognize as people who are immunocompromised, even if they are less than 60 years, we will advocate for the third dose.
Okay, but the general population, they do not need a third dose yet.
We don't have a recommendation for general population.
Okay, thank you for the clarification, Dr. Rabindra. And I'm sure our colleagues at the Malacanang Press Corps will have questions for you. Let's proceed now sa ating open forum. Go ahead, please. Yusek Roque.
Yes, good afternoon, Secretary Roque. Good afternoon, Dr. Rabi. From Laila Salaberry of Inquirer. Question, and now that COVID vaccination is open to the general population and officials say the supply is stable, how likely is it that the President will make COVID vaccination mandatory? Will he ask Congress to approve a bill for this? And if yes, when?
That's for Congress to enact if Congress wishes so, no? But right now, because the supply have just arrived, no? Let's see, because I think the level of vaccination, the level of individuals who want to be vaccinated, no, is already very high, no? So baka hindi pa naman kinakailangan sa ngayon. So napakadami pong gusto lang mabakunahan at since nandiyan na po ang supply, ubusin muna natin yung gusto mabakunahan bago natin pag-isipan yung pagpasa ng batas para maging mandatory po ang pagbabakuna.
Second question ni Laila Salaveria, the President said those who are hesitant to get the vaccine are a problem. While vaccination is not yet mandatory, what will the government do about those who will still refuse to get the job?
Dalawang bagay po, no? Mataas po ang gusto ng yung kagustuhan ng kababayan natin na mabakunahan, dati-rati po kulang nga po supply. So ngayon po sinasabi na natin, meron na po tayong supply. So protektahan natin ating mga sarili, ang ating mga mahal sa buhay sa pamamagitan po ng pagbabakuna. At makikita nyo naman po ang government communication ay wala pong tigil ang paghihikayat sa ating mga mamamayan na magpabakuna na.
Opo. Question from Daphne Galvez ng Inquirer.net. The new alert level system will still be only implemented over Metro Manila. When will this be expanded to other areas? How long will the pilot study run for until the IATF arrives at a conclusion that it is effective? Similar question with Denisa Fernandez ng Inquirer.net.
Kakatapos lang naman po nung first pilot, no? Antayin natin na i-analyze ng mga dalubhasa ang mga datos para magkaroon tayo ng conclusion po. So, antayin lang po natin ang komento ng mga dalubhasa kung successful o hindi itong pilot.
From Rosalie Cos ng UNTV, posible bang payagan muli ng Pangulo ang rekomendasyong deployment ban ng DOLE sa Saudi Arabia kaugnay ng mga di nababayarang sahod sa OFWs? Ano ang deciding factor ng Presidente dito at paano matutulungan ang mga apektadong kababayan?
Dadaanin po muna ng aking BFF na si Secretary Bello sa usapin itong bagay na ito. No? Siya po'y patungo sa Middle East, kung di po ako nagkakamali, ng buwan na ito, no? 22 o 23, no? Para makipag-usap nga po sa mga otoridad doon sa mga bansa sa Middle East.
Opo, second question po niya, may maaari bang gawing intervention o hakbang ang palasyo kaugnay sa posibilidad na hindi makapagbigay ng 13-month pay ang mga employer dahil sa impact pa rin ng pandemic sa mga negosyo? Ano ang maaaring maitulong sa mga negosyante at manggagawa upang mas magiging mainam ang Disyembre ngayong taon bukod sa isinusulong na ingat buhay para sa hanap buhay?
Alam niyo po kasi na naging issue na yan ng isang taon. Yung nakalipas na taon kung pwede ma-exempt yung pagbabayad ng 13-month pay. Ang sagot po, hindi. Dahil yan po ay batas. Pero dahil alam natin na maraming mga small and medium scale industries na nahihirapan nga po dahil nag-lockdown na naman tayo, no? Magbibigay naman po ng assistance ang ating gobyerno sa pamamagitan ng Small Business Corporation, no? Para dun sa mga small and medium scale industries na kinakailangan ng tulong pambayad sa 13-month pay.
Opo. Question from Daphne Galvez ng Inquirer.net. Health Secretary Duque claims he was not consulted on the decision to lift the quarantine requirement for vaccinated travelers from green countries, saying he was absent during the meeting as well as Secretary Galvez and Secretary Año. He raised some concerns on the issue, pointing out that the vaccine coverage in the Philippines, which is at 30%, is still low. Therefore, it is not yet advisable to do this. How was the decision to lift the requirement made? Were health experts consulted when Secretary Duque himself was not there? Who made the proposal to lift it? Similar question with Ivan Mayrina ng GMA News, Maricel Halili TV5, and Raymond Tinasa ng Bombo Radio.
Alam niyo po, marami kaming wala doon kasi akala namin magto-talk to the people sa Davao. So, lahat po kaming magkakasama sa Davao, wala sa meeting kahapon. Pero kahapon po, verify ko kung sinong naroroon. Nando naman po si Dr. Edsel Salvania at siya po yung nag-manifest na minimal naman daw po ang risk galing dito sa mga green countries kasi nga po, kaya sila naging green countries, napakababa po ng kaso ng COVID. So, tapos meron pang PCR test. Bukod pa kay Dr. Edsel Salvania, nandun din po si Yusek Vergere, nandun din po si Dr. Althea ng Epidemiological Bureau. Ganun pa man, itong pulisiya naman pong ito ay effective lamang para sa isang araw. Bakit po? Kasi yung green list, irerepasuhin po yan pagdating po ng November 16. So mamayang hapon po pag-uusapan at titignan nga ako ano yung mga nasa green list. Pero I'd like to assure you, kanina na-interview ako ni Erwin Tulfo, natawa na nga kaming dalawa kasi kasama dun sa mga green list ang mga country gaya ng Nauru, Eritrea, Tajikistan, Tonga, at ang tanong nga ni Erwin kanina, napakadami bang Pilipino nanggagaling dito, no? Bhutan, Kiribati. So sinasabi ko, effective siya for one day kasi bukas iriripaso yung list ng green list at saka kakaunti lang po talaga ang mga Pilipino na nanggagaling o kahit sino pang mga biyahero nanggagaling dito sa mga green list countries. Bagamat kasama po sa green list ngayon ay mga bansang China, no? At saka ang bansang New Zealand at ang bansang ano pa ba, yun po yung mga more or less popular amongst Philippine travelers. Pero yung iba po talaga, kaunti lang mga Pilipino yan. American Samoa, Cayman Islands, Comoros, Falkland Islands, Mali, Palau, St. Pierre and Miquelon. Ito po talaga yung mga bansa na pati sa aking eleksyon sa ILC, napakahirap makontak.
So, Secretary, clarification, October 16, re-repasuhin yung green list, not November 16 na na-mention mo kanina
Oo,
lang,
October
Secretary.
lang nga pala tayo. October 16 po. Maraming salamat, Yusek Roque. Mamaya po, pag
Opo.
pupulungan muli yan para iripaso po kung ano yung mga green list. Pero gaya ng aking sinabi, ito pang lugar na saksakan ng baba naman ang kaso ng COVID at wala naman pong risk, no? Pero ganun pa man, titingnan po natin. At saka, wala naman pong permanent na resolution tayo. Kung merong talagang tumaas na mga kaso sa mga bansa green list, po pwede naman pong repasuhin ang polisiya.
Opo. Question, Denisa Fernandez sa Inquirer.net. May we get your statement on President Duterte's remark on vaccinating hesitant people while sleeping?
Joke lang po yun, kayo naman. No? Siyempre naman, no? Ang tagal ng mga pagpupulong namin sa Talk to the People, ang nakikita nyo, kapraso lang po, mahaba yung mga meetings na yon. Para hindi kami makatulog, kailangan naman may konting joke.
Opo. From Maricel Halili ng TV5, Philippine College of Physicians President Dr. Maricar Limpin admits most health workers are apprehensive of easing restriction in the NCR despite decreasing COVID-19 cases. Limpin says while the situation is not as bad as before, many hospitals are still operating near full capacity. What can you say about this?
Nako, ewan ko po kung saan niya kinuha ang datos niya. Pero ang datos po namin, napakaganda po ng ating healthcare utilization rate ngayon. No? Sa ICU bed, sa Metro Manila, 65% lang po nagagamit. Moderate risk. 44% ang isolation, 48% ang ward beds, at 50% ay ventilators. Kinakailangan po, kung maaalagaan naman natin ang mga seryosong magkakasakit, bigyan po natin ng hanap buhay ang ating mga kababayan. Huwag po tayong lockdown ng lockdown. Kasi nga po, wala pong tamad ng Pilipino. Gusto lang nilang pagkakataon makapaghanap buhay. So ngayon po, at 65% occupancy ng ICU beds, kaya po nating alagaan ang mga seryosong magkakasakit. Pero sa Metro Manila nga po, halos 80% na rin ang mga bakunado. So asahan natin na kung magkaka-COVID man, yung tinatawag nating, anong tawag doon? Anong tawag doon sa nabakunahan na pero nagkaka-infection pa rin? Breakthrough infection, napakakunti po nito. 0.00025 nga ata ang sinabi ni Dr. Domingo. No? At saka pangalawa, inaasahan nga natin na yung kaunting magkakasakit na breakthrough infection ay hindi po ito seryosong magkakasakit. Hanap buhay muna po ang ating asikusuhin ngayong 65% po ang ICU bed capacity natin.
From Eileen Taliping ng Abante Tonight, pwede na bang lumabas ang senior citizens sa alert level 3? Sino lang ang mga papayagan kung sakali?
Kung bakunado, dahil binigyan po nating incentive yan sa mga seniors, po pwede. Kung hindi bakunado, para lang po sa mga essentials at para po maghanap buhay.
From Angel Ronquillo ng DCXLRMN, anong basis daw po sa no facility-based quarantine sa mga fully vaccinated foreign nationals and returning Filipinos?
Well, ito po ay base naman sa siyensya kasi para lang po yan sa green list countries. Ulitin ko po, yung karamihan ng mga pinanggagalingan ng Pilipino, yellow list countries po yon, subject pa rin to 5-day facility quarantine and PCR on the 5th day. At saka home quarantine for additional 5 days.
Yes. From Angel Ronquillo pa rin po, pwede na ba ang mga foreign tourists na makapasok sa bansa?
Hindi pa po. Wala pa po tayong foreign tourists. Mga long-staying visa holders lang po.
Opo. Third question niya, may shortlist na ba sa magiging bagong PNP chief? Magre-retiro na kasi si PNP chief sa November 13.
Well, yun nga po, no, nakakalungkot na may retirement age si Chief Eleazar. Sana panghanap buhay, habang buhay ng Chief si Eleazar, no? Pero siyempre po, meron naman pong shortlist ang Malacanang. Hindi ko nga alam po pwedeng sabihin kung sino-sino to.
Opo. From Lanes Capanti ng GMA News Online, Spokesperson Roque said during Monday briefing that there is no vaccine shortage anymore, but President Duterte said in Talk to the People, he is to blame over vaccine shortage. Which is which? May shortage ba o wala?
Sa ngayon po, wala. Pero sa nakaraan, napakatindi po. Kasi nga po, 85% ng ating mga bakuna napunta nung mga unang parte ng taon sa mga mayayamang bansa. Ngayon po, sunod-sunod nga po ang pagdating. No? Ang cumulative po na natanggap na natin is around 88 million vaccines. No? At inaasahan natin na bago matapos ang Oktubre, we will have a cumulative of 100 million vaccines. No? So, sagana po tayo ngayon sa vaccines.
Opo. Question from Lanes Capanti pa rin po ng GMA News Online. SWS poll showed 91% of Filipinos are afraid that their family getting infected with COVID-19. Does this mean that the public is not confident with the government's COVID-19 response? Why or why not?
Hindi po. Ang kinatatakutan nila yung virus. At dapat lang po kayong matakot, ha? Kasi pag hindi kayo nagmask, hugas, iwas at bakuna, talagang pwede kayong magkasakit at pwede kayong mamatay. Dapat po katakutan yan. Pero pag tayo nagmask, hugas, iwas at bakuna, pwede tayong maghanap buhay.
Opo. Tinatanong lang din po nila Nesca, pwede na po ba daw ang indoor basketball?
Nung binasa ko po kanina, pwede lang yan kung bubble type, no? Provided for, at saka merong relevant guidelines adopted by the IATF, the Games Amusement Board, at iba pa. Yung approved ng LG.
From Chris Sen ng Remate Online, humihingi po siya ng update kung kailan daw po ipalalabas ang guidelines sa pagpapaluwag sa paggamit ng face shield.
Lumabas na po. Lumabas na po ang guidelines. This is dated September 23, 2021. Well, hindi. Lumabas na po itong Joint Memorial Circular. Unnumbered pa lang. Basahin ko po, no? Ang face shield ay kinakailangan lamang sa mga 3Cs at ito po ang guidelines. Sa mga community, yung sa labas ng residents, mandatory po ito sa close, crowded, and contact. Ano po itong mga 3C settings? Kasama po dito ang indoor activities and settings, lalong-lalo na kung mayroong crowding or higher risk of exposure dahil nga po dun sa nature na activity. This may include activities in commercial establishments, public transport, among others. Indoor and outdoor dining except during actual eating of meals, indoor and outdoor gatherings or crowded settings, especially when the 1 meter physical distance is not possible. This will include indoor and outdoor commercial establishments, food establishment, malls, public markets, transport terminals, and PUV stops. Indoor and outdoor activities that promote close contact such as personal care services, among others. Indoor and outdoor activities that promote close contact such as personal care services, among others. Other activities not otherwise specified that follow the 3Cs framework. Okay? So lumabas na po itong joint memorandum circular signed by Secretaries Duque, Lopez, Bello, Anyo, Villar, and Tugade.
From Lay Albis ng GMA News for Dr. Rabi, the vaccination of 12 to 17 years old with comorbidities will begin tomorrow. May we ask for a comment from WHO?
Thank you, Secretary. WHO strongly supports this. This is a sage recommendation. Adolescents between 12 to 17 years who have comorbidities, we are encouraging them to be included in the primary group of vaccination for vulnerable populations. So we support this.
From Prince Goles of Abante, Secretary Roque, Dr. Tony Liachon has raised concern about the opening of cinemas in areas under Alert Level 3. He said this will put individuals at higher risk for COVID-19, citing possible crowded audiences and poor ventilation. Does the palace think that it's already safe to head back to the movies, and why?
Hindi po kami matatakot sa kahit anong rekomendasyon ni Dr. Liachon. Una-una, ito po ay para sa mga bakunado lamang. Pangalawa po, 30% seating capacity, wala po yung magkakatabi. Number 3, meron pang guidelines na in-issue po ang ating DOH na kinakailangan may ventilation, may use of air purifier system. Isipin din po natin yung mga naghahanap buhay na related sa mga sinihan. Hindi lang po yan yung mga sinihan mismo, kundi yung mga artista, mga cameramen, mga extras, lahat po sila nakasalalay dyan sa hanap buhay. Hanap buhay po ang pinag-uusapan at hindi po natin sinasakripisyo ang kalusugan kasi nga po dumating na tayo sa punto na halos 80% na rin ang bakunado dito sa Metro Manila.
Opo. From Red Mendoza, the Manila Times, for Dr. Rabi, Presidential Advisor Joey Concepcion said in the previous interview that the WHO does not understand his proposal of vaccine bubble after you said that the bubble may burst. What can you say about this?
Thank you, Secretary. The understanding is that we don't have enough vaccine coverage in the country to create bubbles. The discrepancy on coverage is very significant, and there is no way that we can maintain the intactness of a bubble. So in those circumstances, I think it's premature to talk about bubbles because our vaccine coverage in the country is only 30% at this point of time.
But Dr. Rabi, follow up. What about in Metro Manila? When we hit 80% or higher, is that a possibility for Metro Manila?
If we can also reach similar levels of coverage in the adjoining NCR plus areas, because we know that there is a very high movement of people between 3 and 4A, particularly coming to work and for trade activities into NCR. So in that circumstances, it may be premature to create bubbles in NCR because undoubtedly there will be people with low coverage coming into those bubbles. So our contention is that if we can achieve the rates of higher coverage in 3 and 4A, then we may be able to look at it, because then the number of people coming into the bubble will be significantly less who are unvaccinated.
Thank you for that.
Yes.
So talagang dapat na dahil marami na nga ang bakuna, no? Yung mga LGU po ng Region 3, Region 4A, pauman po, talaga namang nagkulang ang bakuna noong una, pero ngayon nandyan na po, paspasa na tayo para talagang magkaroon tayo ng bubbles sa NCR+. No? Yes, next question please.
Opo, second question ni Red Mendoza ng Manila Times. Dr. Rabi, do you think that DOH was prudent in lowering restrictions?
This is a global pandemic, and we are adjusting or calibrating the restrictions because we don't want to talk about lowering or relaxing. It is important to understand that we are trying to manage and bring back as much economic activity as possible while not putting people's lives at risk. So this adjusting and calibrating is important, and we need to be very clear in our communication. It's not about relaxing or reducing the restrictions. It's about calibrating so that we continue to take risk-based measures. We continue to urge the population to do everything, the physical distancing, the hand hygiene, the mask wearing, even though they are fully vaccinated, because these are critically important to maintain the gains and further strengthen the transmission reduction. We now have less than 2,000 cases on the average on a daily basis in NCR. We want to see that going down further. And so we need to be very careful in calibrating and adjusting restrictions so that we don't get risk. At the same time, we are also aware that in some regions we are still seeing increasing trend and transmissions, particularly in regions that Spokesperson Harry just mentioned in northern Luzon and some parts of Visayas and Mindanao. So we are not completely out of this, and we need to be very careful the messaging and the relaxation of the non-pharmaceutical interventions.
Question from Ace Romero. Dr. Rabi, what is your comment on the easing of restrictions in Metro Manila, which will be downgraded to alert level 3? What are the things that Metro Manila have to watch out for to avoid another surge in infections?
Thank you. With the high vaccine coverage in Metro Manila, we believe that we need to adjust and calibrate the restrictions. And that's why WHO took up the position that we support the granular lockdowns, we support the easing of restrictions, because broad lockdowns have terrible economic consequences and affect the people negatively. So we are supportive of this, but we need to be very careful. That's why I said we need to calibrate our response. We need to continue to urge the LGUs to ensure that access to testing is maintained. And we need to urge the population to do everything they can to quarantine or isolate themselves if they are having symptoms, not go out, so that they don't put other people at risk. This has to be a whole of society approach that everybody contributes to, so that we can come out of this without going back into another surge. So while the calibrations are important, we have to very carefully monitor this, and we need to be flexible enough to tighten restrictions in very granular areas if we see localized transmission happening within cities or within puroks or barangays, as the case may be.
Thank you, Dr. Roque. Secretary Roque, kung may talk to the people daw mamaya.
Wala pong nakaschedule mamaya, kaya po tayo nag-press briefing.
Thank you, Secretary Roque, Dr. Roque.
Okay, so wala na po tayong mga katanungan. Thank you very much to our guest, WHO Representative of the Philippines, Dr. Rabindra Abeyasinge. Maraming salamat, Yusek Roque. Maraming salamat sa ating mga kasama sa Malacanang Press Corps. Sa ngalan po na inyong Presidente, Rodrigo Roa Duterte, ito po yung spokeshari nagsasabi, Pilipinas, malapit na po ang ating tagumpay laban dito sa COVID. Pero habang wala pa tayo doon, mask, hugas, iwas, bakuna. At napaka-importante po na ngayong meron na tayong supply, pabakuna na po tayo para po proteksyon sa ating mga sarili at sa ating mga mahal sa buhay. Magandang araw sa inyong lahat. Good afternoon, Philippines.
Ang tagal mo na nawala.
Kapag tayo agad magpapabakuna, mabilis babalik ang masayang buhay. Para lahat tayo, balik pamilya,
Balik buhay.
balik trabaho, balik buhay.
Balik buhay.